able to present this with you today. Let's see, pause share. All right, am I supposed to start the recording or are you?
I
Or,
I I
oh,
have it.
you. Oh, sorry. Okay, my bad. Let me hide this. Okay. So, thanks for being here today. I'm excited to be talking with everybody about this. So, what I am hoping that you'll think about as we go through this is a simple but important idea. What we think is normal in social work is often just what we're used to. And so, I think what we can do through this international comparative thinking is challenge our own norms through a different lens. And so, what we're going to do in this session is take a comparative conversation look at social work practice in West Virginia alongside Iceland. We're not doing this for the sake of saying that one system is better than the other, but instead to exercise the idea that comparing can be a tool for reflective practice. And so, towards the end of this session, I'll be talking about how we can use that tool to help our own practice sharpen around client engagement, systems thinking, service delivery, things like this. And so, my goal for today's session is not only to see some interesting similarities and differences between West Virginia and Iceland, but that you can also turn a reflective eye towards your own practice and also thinking about our own systems a little differently. So first of all, before we dive in, I would love to give some thanks to all the folks that helped make this happen. The West Virginia Higher Education Policy Commission, their international division with Clark Egnor and Candace Lane with the behavioral health side of things. Of course, the School of Social Work and also the Faculty of Social Work in Iceland. My co-author, Dr. Gudbjorg, and then, of course, last but not least, the team of people that helped move all of this work forward. And so, our learning objectives today are first looking at some similarities and differences between social work and different practice contexts. That's where Iceland comes in. And then we'll kind of zoom out a little bit and consider how global perspectives from any country could help us inform our own practice here locally. And then also consider the limitations and the ways to adapt the learning that we're doing in that comparison. And so I want to just open up the conversation with a question. I don't have a formal poll on this Zoom session, but I just want to know, how often do you kind of think through intentionally comparing social work in West Virginia to other countries? You can just drop that in the chat if you want to. I'm looking for answers like never, occasionally, mostly, but I'm just looking at how they're different. Or are you like one of those active comparison people? And I'll bring up the chat here to see what folks are saying. Occasionally, never, not often. Right? Yeah, not seeing anybody pop out to say, yeah, I do this all the time. That's occasionally a coworker. Oh, I have a coworker from Iceland. Oh, very cool. Talked about social work. Oh, you think about it because your husband's from a different country. Yeah, not often. Occasionally, some countries have more resources. Sure. Yeah. Yeah, these are all great things to kind of ground ourselves in. I know I find myself kind of in that same boat a lot of times. And actually, this is what sparked this idea for this lunch and learn was that once I did go to Iceland and talk to a social worker there, I realized, wow, there is so much more similarities than I thought. And also the challenges that you're facing. I'm learning a lot about how you're addressing those challenges. So that's what I wanted to bring here to you all today. Um, and so what we're going to be doing is kind of gently challenging that assumption that because these other countries have different resources or more resources, they're far better off, or their social work practice is far better, or their client systems have needs that don't really look the way that our needs do. And actually, I've challenged all those assumptions myself and found that a lot of those assumptions for myself were not true. Um, Looks like somebody's done some contract work and international participants. Very cool. That's great. Alrighty. So moving in then, I kind of talked about this a minute ago on the other slide, but what we are hoping to see from this conversation is that our social work problems are very similar across contexts. We're still seeing mental health needs, substance use needs, intimate partner violence, and access to services and culture around services can be very similar. But then, of course, the points of differentiation come from the systems, the policy, the funding, and the cultural expectations around systems. And so that's where the comparison can really be a powerful tool for our own evaluation of our own practice. And so, again, the goal here isn't to decide which system is better, but it's more understanding what comparison can reveal for our own practice. And so, kind of framing the conversation, why Iceland? Well, it all kind of happened a little on accident and a little intentionally. And so I'll show you kind of where we started with the accidental intentional thing. Um, so I didn't go to Iceland to learn about social work practice. I actually went to present at a conference about an entirely different topic, virtual reality. Some of you may have been in some of my CE sessions in the past about virtual reality. So I went there to present, and while I was there, I just said, "Hey, let me see if there's other." Obviously, there's social workers there, and there's a social work school there. So I opened the door to that possibility. And so I looked up the faculty of social work at the University of Iceland, and I reached out, ended up meeting with a faculty member, Dr. Gudbjorg Audesdottir, and we had coffee. And we had a really wonderful conversation just over coffee. It was one conversation, but I learned so much. And Gudbjorg was so generous with her time and with answering all my questions. It was really, really a wonderful opportunity to learn. And so, what I'm bringing to you is all the things that I learned in just that short amount of time, and kind of using that as an example of how we can learn a lot if we approach things informally. And so this is kind of the point here is that we don't always have to do something that's a formal engagement, right? We might just be able to say, "Hey, I'm a social worker, you're a social worker. What stuff do you do? How do you do it?" And they want to learn from us. Actually, I learned that Iceland is quite interested in a lot of the work that we do, and I'll explain that in a little bit. I don't want to spoil the slides in the future. But during our coffee shop conversation, I really focused on what are the similarities, what are the differences, and then that helped me kind of think about what assumptions are embedded in each of our systems. And so, as I've kind of been alluding, the insight into Iceland's welfare system was really helpful. I learned a lot about the similarities and differences that I'll talk about in the next couple of slides. And so I just want to also say that I've shared some photos here that you'll see throughout the presentation. Just because when we talk about international work, it's fun to share photos of when we visit there. And so you'll see kind of some captions and explanations of the photos. I was able to go on a tour after the conference that was called a Sacred Sites tour, where we did visit some significant natural landscape landmarks in Iceland. So you'll see some of those in the pictures, and I hope that those pictures will help ground us in the conversation about that place. Not really to romanticize Iceland, but more just to kind of see those comparisons of similarities and differences. And so let's launch into that section of our presentation here. So one of the first similarities I was struck with was size and geographic isolation. So first of all, compared to our neighbors, both of us are small compared to those around us. West Virginia's population certainly smaller than other states, and Iceland also small compared to other European countries. And then also geographically isolated. So of course we know West Virginia is mountainous and We know all the challenges with transportation and access to services. Well, Iceland also has that similarity. They're geographically isolated. They are literally an island. And for a long time, they didn't even encourage or have a whole lot of international interaction until around the early 2000s. So then we also have natural beauty. We often have a lot of visitors coming to our spaces to enjoy the natural beauty of our spaces. Um, and so immediately what struck me was like, wow, they also have rural social work and they also have challenges with transportation and access. But then when we see in a couple slides, it'll be interesting to see how Iceland is addressing those challenges. Another similarity was the social pressures. And so, just like we face here in West Virginia and across the country, they are also experiencing workforce shortages in social work across all different types. They also are struggling to recruit people into the educational programs, just because it's, trying to help young people understand what social work is, the benefits of the degree, and the ways that they can use that degree in lots of different ways. So Iceland struggles with that, just like we do here in the States. They also have a great amount of youth mental health concerns. There's a lot of concern about the mental health of young people broadly, but also suicide concerns among young people in Iceland. And so, of course, unfortunately, we do have those similarities here in West Virginia. And also, they do have the challenges of substance use disorder, intimate partner violence. Those are all similarities. And, I think one thing that I assumed when I thought about a Nordic country and their welfare system was that these wouldn't be prominent issues. But in fact, those are issues that we see that are very similar in a lot of ways, not in all the ways, but in a lot of ways to what we do see here in West Virginia. Another similarity is some cultural tensions that we have. We've both been, because of our geographic isolation, we've both been culturally isolated. And in Iceland, that's particularly been a racial isolation. And so, like I said, Iceland didn't really open up its doors to international uh, migrants, immigration, or visitors a whole lot until the early 2000s. And so this whole idea of having a more diverse population is fairly new to Iceland. And so ongoing challenges with inclusion because of that racial isolation, we do see racism showing up in Iceland in some similar ways that it does here in West Virginia. Of course, there's some important differences, but that was an interesting point of learning for me. Unfortunately, although the LGBTQ rights in Iceland are quite robust, there is the growing sentiment against transgender youth in particular and their access to gender affirming care. Right now, they still have a very good landscape for the rights of transgender youth. Transgender youth are able to make their own name changes and do access gender affirming care under the guidance of a doctor. But there's growing sentiment against that, which is really threatening the well-being of transgender youth there. And of course, we see that here in West Virginia with the banning of gender affirming care and the walking back of basic human rights for trans and gender diverse people. And then, of course, we do see the rapid demographic shifts. Of course, in our state, we're seeing the continued aging of our population without the birth rate replacement. And so Iceland is also seeing that. All right, so those were the similarities I noticed. Some of the differences, we would start with the structures or systems. So, of course, Iceland has what they would call a Nordic welfare model. And what that means is that they have a national mandate for various services, health services, other kinds of public health initiatives. And so the national system mandates that it is supposed to be offered to everyone. But then the local municipalities are the ones that decide how that is delivered. And so, because of the differences in different regions, of course, like the main capital city, Reykjavik, is going to be a much larger, more urban area than the more rural parts of Iceland. They leave the implementation up to each of the municipalities, based on how I'm not sure exactly how they differentiate those. But that means that there can be a good amount of variation from location to location within the country about what resources are available, how you access them. Um, and that means that there are some disparities. There's resource disparities in how maybe a rural space doesn't have as much funding as the urban space. And so they have to implement things differently in their rural spaces. And I know we often face that here in West Virginia, not because of that particular type of dynamic, but this it did remind me of how we have county level variations in our own systems, or regions. You know, we have a regional service system that might decide to do things differently than a different region service region. Um, and so those are some differences. And then, of course, in our own welfare system, we use eligibility to determine access to services rather than a national mandate. And rather than having one single funding stream for all of their services, we have multiple different streams, and we also have a diversity of streams. So, of course, we know we have some state-based funding, we have some private funding, we have some personal individual funding. So there's lots of different funding streams. And then, like I said, it's different sometimes from county to county. And so this just kind of illustrates that there's different assumptions about what the government or what the state is supposed to be doing. And that is dictated from the very top of that policy, and that kind of trickles down into the assumptions shared amongst the people. Another difference that I found that was interesting was professional regulation. So we know how licensing and licensure exams work here, but in Iceland, they have no social work licensure, not any kind of licensure, not clinical, not whatever. All they do is graduate from an accredited program, and there's one accredited program, the University of Iceland. And then they just register after that. So there's no exam requirement, there's no licensure requirement. And they also do not have clinical social work there in the same way that we do in the States. So if a person in Iceland wanted to do a specific kind of therapy, they would go to a psychologist or psychiatrist. Um, yes, exactly. Yes, good thoughts in the comments here. Um, So, yeah, so it opens up access a lot, and yeah, there's a lot of barriers that come into play in our system where we know now with data what we've known for a long time, which is the clinical licensure system is highly racially inequitable, meaning that uh, Black and brown people are not able to access the same clinical licensure at the same rates as people that are white presenting. And that's just one of the many demographics that we see that are unequal here in the States. Um, and one of the other things that's interesting is that social workers there don't provide clinical services in the same way that we do here. So they don't have billable codes because they don't bill anybody because they don't have insurance. They just show up to work, they show up to their agency, and they do the kind of social work that they do there. So if you're at a children's agency, you do children's work, and that might involve families, that might involve supportive counseling. They do have specific kinds of therapy, and that's where they would bring in a psychologist or a psychiatrist to deliver the kind of evidence-based therapies that we do as clinical social workers here. And that's actually one thing that Iceland was really curious, or at least my colleague there was really interested in learning about, was how the United States has been able to navigate our licensing and clinical landscape to allow social workers to do that clinical work, which, as we know, many, if not most of you here are clinically licensed. And so that has really opened the doors for social workers here to have a pathway to professionalization that's not available to them there. And so they're very curious about how we train our social workers in clinical work and how we've been able to advocate for social workers as licensed clinicians. Another difference is volunteerism. So, because of Iceland's robust welfare system, the assumption that most people have, and this is across many European countries as well, is that the duty to serve people, especially people that are marginalized or need more assistance than others, that is viewed as a state responsibility. And therefore, there's far less volunteerism and what we would kind of roughly call charity. It's not exactly the same, the language translation is a little bit different, but basically, they view us as having a really robust volunteer culture. And of course, we know that's true because we do really rely on mutual aid, charitable organizations, and there's a lot of culture here about showing up to, be a good civic engaged person. And, for example, our students in the BSW program, we require them to do 50 human service hours. And when I told that to the Icelandic person, she was like, "Oh, wow, that would be great." Um, and so it really highlighted this difference of the expectations of who's responsible for care. And the person from Iceland was just saying how much she wished that more people would take on that personal responsibility because she does see that, more hands help lighten the load, and also with the workforce challenges. Even though they might be able to pay for the workers, they're not able to recruit people the same. Um, Question about the number of psychologists and social workers. I don't know the answer to that, though I would encourage a Google search for that. Yeah, so those are some of the similarities and differences. Um, so, time to kind of pause for discussion. What similarities and differences surprised you, felt familiar, what made sense? And then what kind of assumptions do you have now about Iceland that maybe are less fixed, or what assumptions shifted? If anybody wants to hop on to voice, you're welcome to do that too. Surprised they don't have the licensing requirements. Yeah.
I have a question.
Yeah, go ahead, Elise.
Did you talk to the person you interviewed about like how someone from the States could possibly like transfer to working in a place like Iceland? Like, is it like would that be similar or would that require like going back to school? Or I'm just like concerned, like not concerned, but I'm just curious about like how it would translate.
Sure. Yeah, I did not ask that specific question, mostly because they they would mostly do that through like comparing the degree and the syllabi, and then they would determine whether or not a degree was comparable to their degree there. And then if that's like the check mark that you have to select is like, is the degree comparable? And if so, then you qualify to register as a social worker. But there's also those challenges in getting a work visa, and all the things that go into being able to qualify for work internationally. I don't really know the answer to that, but with their workforce shortages, maybe they need more social workers. There is a language barrier, but a lot of Icelandic people speak English. It's not an official requirement, but because of the high tourism, they do a lot of people speak English there, but they do have their own Icelandic language. And that's actually one thing that um, keeps us back from doing any kind of real student exchange where we could send students there because they teach their undergraduate programs in Icelandic. So that would be a challenge in the US to Iceland direction. But they do teach their PhD classes in English, in case anybody wanted to go to Iceland to get a PhD in social work. Um, yeah, we've got another thought here. Interesting how in the US there's a strong push toward clinical work because of insurance, but other countries, social workers supposed, yeah, focus more on systematic challenges. Yeah, that's a great observation from Dr. Fabry. Just how much a lot of our work is dictated by this insurance system, that we work within. And so how could social work look differently here if we don't have to worry about chasing down billable hours and documentation and all of the things that we do as clinical social workers? Somebody says, is there lack of licensing specific to Iceland or the same across Europe? I got the impression that it is the same across Europe. I can't say that for certain, but in talking with some of the other European folks that I encountered, it's a very similar situation that there's not the same kind of social work licensure. Someone says, surprised MSWs do not do therapy services since the continued mental health concerns, like in the USA. Yeah, yeah, and that's exactly right. So one of the things that they noticed is a hesitancy or the difficulty in getting people, clients to engage in clinical services. And so they, I think, are interested in allowing their social workers to do licensed therapy, but I don't know that it's gone anywhere. Okay, we've got a Google. Moving from the US to Iceland is highly difficult due to strict non-EU immigration laws, living costs, and competitive job market requiring specialized skills. Okay, that's what Google says. We'll see. Maybe I can ask my Icelandic colleague and get back to you with some specifics. It surprised me to hear all about the similarities. I think in America, we assume there's barriers to care in other countries with universal health care. Yeah, exactly. Yeah, that's the kind of assumption I came to the table with. My assumption is that healthcare and resources in countries with universal healthcare is without challenges. Yeah, exactly. I know I was thinking about that too, about how like, well, if everybody has access to the services, why wouldn't they use it? But then you've got stigma and you've got misunderstanding of mental health and you've got the lack of social emotional awareness and all the challenges that come with substance use and the kinds of genetic mental health disorders that are there regardless of culture, all the things that can still happen, trauma, abuse, all those things obviously are unfortunately more human universal problems. How the role of volunteerism shifts. Yeah, that's an interesting dynamic. They really kind of see, and it's, just in the same way that we've had some assumptions about Iceland shift just in this short conversation, I'm sure they would have some assumptions shift as well, that we know that not everybody here is just out to volunteer all the time. And actually, we're constantly trying to recruit volunteers. And, uh, there's tons of things that need to shift here in terms of volunteerism culture. Um, yeah, looking at Google, 65 of us social workers are in private practice as opposed to 3% in Iceland. Yeah, yeah, study abroad. Uh, what percentage of their income is taken to pay for universal health care and social programs? That's a great question. Yeah, these are all great. And see, I love this. This is great. This is the whole point of this conversation is to help prompt these kinds of questions. So great job, guys. I love it. Um, yeah. And so one thing that I did learn is that social workers can still do the kinds of supportive therapies that we do here. But they're not going to be able to say like, they're not going to be able to hang a shingle in the same way and say, yes, I provide therapy because the Icelandic government does regulate therapy services and they require a clinical license. And so I think if social workers were to hang their own shingle and have a private practice, it would have to be under the title of supportive counseling. 22.5% for taxed income up to 4.3 million. Thanks, Elise. Yeah, we're learning a lot here. And then so I wonder with that Google response about how hard or easy it is to move to Iceland and work there, given that they have a workforce shortage of social workers, I would wonder if that's a little different. You know, Google has a lot of generalizable responses or generalized responses, I should say. And so I'm wondering if like nursing, social work, doctors, those kinds of things have workforce shortages all over the world. Um, yeah. So one that's actually a misconception. The funding is all through the government. There's no way to be paid other than through the government approved programs. Um, there are additional funds available. And so, for example, I got to know the National LGBTQ Advocacy Organization there. And they actually have additional grants that fund some of their work. And so they do get paid in their local municipality services through the government, but and that's where the majority of their funding comes from. But they do have other kind of grants and other kind of private opportunities. All right, we're getting lots of more good stats in the chat. I'll let you guys keep doing that so we can all make a plan to move to Iceland. Just kidding. Um, so bringing it home. Now that we've thought about Iceland a bit and kind of seen some of the interesting questions that it generates, how does that help us with our practice here in West Virginia? And so, just to kind of stop there for a minute, why comparison itself matters. Social work problems, as we know, are complex, and we know that human behavior is complex. And so, we know that when we see the same kind of human behavior across cultures and we look at how systems differ, that can kind of give us some insight into like, oh yeah, we're doing this and this works really well, but oh gosh, they're doing that. Maybe that could work better. And really, the truth is no single system has all the answers, right? We have very different contexts for our systems. And so the point in looking at this context of Iceland is not to say that one is better than the other, but to expand our own thinking around what we do and how it could be informed by other contexts. And so one of the things that comparative learning helps us do is understand client engagement better. We realize when we have these comparisons that clients aren't just responding to us individually and our rapport building skills and our engagement skills, but they're also responding to the system around us. And so it might be that a client who could really benefit from our services never makes it to our doorstep because of this system that we have set up, and that could be different in other contexts. It also helps us understand clients' interactions with systems in terms of their trust of systems. Even though there's universal healthcare in Iceland, there's still a hesitancy to seek out help. And so we can understand how the need for public awareness of mental health and wellness kinds of initiatives can be really important. And we also know that systems shape access. And so if we're thinking about access to care, we think about that a lot here in West Virginia. We see that there is a benefit to having more readily accessible services in some respect. They would be able to see a social worker very quickly, but how quickly would they be able to see a licensed therapist? I don't know. Um, and of course, this all highlights the different cultural and structural influences on the help-seeking behavior of clients. And so when we think about what drives people to our services, we can use this comparative thinking to help us understand our own context better. And then this is kind of all what contributes to us being more systems aware is the term I would use. Because that helps us then think about how we could improve access to care or how we could improve engagement or what kind of things we need to do, especially among populations that have a lower trust in systems. Another thing that global comparative thinking does is helps strengthen our own service delivery thinking. And so a lot of times what we tend to do when we're in systems is think, well, this is just how it is, and we just got to live with it. And that's not always true. There's always room for different kinds of changes, and different kinds of innovations. And so, that policy awareness in your practice is really important. And thinking from a global perspective can kind of give you some ideas. Um, and so that could introduce different models. Like, for example, those of you working in mental health with adults might be aware of the programs of assertive community treatment, or PACT or ACT. Those came from a European model. And we see a lot more influences from other systems. So we really could kind of expand our thinking and when we look at other countries. Um, and then, of course, it also helps us work on this system fragmentation that we have here. I think a lot of us can probably relate to the fact that the continuity of care is hard, whether you're working with foster care youth or with people in substance use treatment or, older adults. Really, the list can go on. That we know our service system is fragmented, and you might have a colleague that you love referring to, but they're not in the right network for your client. And so, helping us really think through how could we encourage less fragmentation in our own system and how that could help clients access resources more readily. Also, global comparative thinking helps us think interdisciplinary because, first of all, we know that no single discipline alone can address today's social problems. And so we do need to look to other disciplines to collaborate. But then it's interesting to see how different roles will dictate different systems, sorry, different systems would dictate roles differently. So, whereas we might be used to being the licensed clinician on a team, we might turn into that systems thinking social worker on the team, and somebody else would do the licensed part. And this kind of flexibility helps us think more collaboratively. And this sort of global thinking also helps us think more about the team-based approach to complex problems. We know that the problems that our clients face are often crossing lots of different life domains, lots of different systems. And so this can help us lean more into the team-based approach to solving those problems. And then another thing that it helps us do is build reflective practice and cultural humility. And so this to me is where the greatest growth for us as practitioners happens. We don't want to say like, oh, Iceland has it all figured out, or this other country has it all figured out. We're not trying to copy them. What I would encourage us to do is to question our own system. And what we can do is challenge what we assume is normal, and why is it normal, and why are we doing it that way? And then realizing how our own system has shaped our own thinking, that reflective practice helps us understand that. And then this really helps us create more culturally responsive practice. I know it did for me kind of highlight again those universal challenges to rural communities that really do cross international boundaries. That rural communities often face very similar things. And so this reflective practice helps us build a critical awareness, and that critical awareness can help us have more ethical and responsive practice. Of course, when we're thinking about this comparative global comparison, we know that there's limitations. Obviously, we can't just separate practice from policy, and policy dictates what we can do. So we do have to understand it through that lens. And also just that what could work in one system just may not be possible in another system. And so the point isn't that everything transfers, is that there could be aspects of how other countries do things that could inform us, and vice versa. A lot of other countries are really eager to learn from how we do things, and we could really do a lot of good cross-cultural learning. And then, lastly, I think, lastly, maybe, yeah, almost. So, what does adaption look like then? What do we do with this comparative thinking? What I think we should do is borrow ideas or think about ideas. Obviously, we can't import a whole new system into where we are, and we don't need to necessarily, depending on who you ask or what perspective you have. But what we can do is look at the underlying principles behind those systems and think about how those principles are applied currently in our system or how could they be applied differently. And as I kind of illustrated here, if we start very small and context specific, then that comparison actually becomes really useful. So it might not be that we're going to set out the changes between an insurance system and a universal healthcare system. It might be that we look at an agency and we look at how they do their intake procedure or how they handle their crisis response. And we say, oh man, that's really powerful. I bet we could do that here. And again, vice versa. We have a lot to offer social services agencies across the globe because of how much work we do and how we really navigate all these really complex systems. And so we really have a lot to offer other countries when we are thinking about our own social work practice. And so I think the one of the take-home messages is that we don't have to think about the country as a whole. It's helpful to know that context, but we can start small and we can think about those ideas that work on a smaller scale. And again, at the end of the day, we're using this comparison as a reflection tool. So it's not so much that we're going to just stand up and do something tomorrow when we learn these things, but we're reflecting on our own practice. We're finding ways to improve it or change it or let it be changed by the demands around us. So that can be a really helpful reflective tool. And so, really, the final takeaway I want to give you is that this global comparative thinking doesn't give us all the answers. It just helps us ask better questions. And to me, when we ask better questions, we are going to have better practice at the end of the day. So it's not so much a question of could we do what Iceland does? The question is, what does this comparison help us see more clearly about what we can do here? And I think that's the final point that I want to drive home. So we've got a little bit of time left. I just want to kind of open it up. I've got some more comments in the chat. Got some things with, let's see, workers in Iceland have a deduction, and then we have substance use issues, make me think of the book Chasing the Scream. There's a link. Work impact. Iceland has one of the lowest poverty rates, and West Virginia one of the highest. It makes a difference when our system is overloaded. Yes, very much so. That's very, very true. I wonder if that collaboration helps decrease burnout among health professionals. Yeah, probably. IHS does global child welfare work. You can see more here. Very cool. So, has anybody had a similar experience where you went somewhere and you happened to be able to interact with social workers there, and did you learn anything? Or if not, if you haven't done that already, would you like to, and where might you start?
I have a colleague that's from Ghana and getting her doctorate at ASU. And that experience in Ghana made her want to come over here because they don't have like the same social work systems and support. And so she plans to like get her doctorate here, but like also conduct the research over there as far as like sh her population is focused on like women's mental health and maternal health. And it is very different. I would say I feel like we could almost be similar to them in the sense that we don't have, I don't think the level of maternal health care that we probably should have in this country. And like because of reproductive rights, like that is only getting smaller. But I'll get off my soapbox. I just wanted to mention that.
Yeah, yeah, that's a great point. Ghana, others countries with more resource challenges that we have, like somebody pointed out the income difference in our country, a whole country versus our state, and how our state has these challenges. We could start with another country that's more similar resourced wise.
Having done training where I have international participants, it means that I really have to suspend my expectation of how the systems work for them. So the organization I've trained for a lot is Institute for Human Services. And then my focus is often trauma-informed care, resilience, child welfare, child mental health. And so I have to suspend what I expect is available or how they approach it. Like I did one training on resilience, and I had a guy calling me from Turkey from a refugee camp. Um, and so his questions were very different because they didn't have any of the resources
Hmm.
that we might expect to be available. And so a lot of it was a shoestring budget and what could they do and how could they help people advocate for themselves and support one another? Because in a refugee camp, like you've just got thousands of or hundreds of desperate people and very few resources. Um,
Hmm.
and then same thing, perspectives on parental rights. That has come up a lot. So when I talk about child mental health, suicidal ideation, LGBTQ kids, what is that culture's perspective on the right of a child versus the right of a parent? What constitutes abuse?
Hmm.
Um,
Hmm.
do you think you have to be a lot more open-ended and a lot more open to um, another person's perspective on what is, again, that view of what's normal? I mean, all you have to do is ask people what normal breakfast looks like to figure out how
Yeah.
different the world is. Like, what do you eat for breakfast? And our breakfast is very different from what a lot of the rest of the world eats at breakfast.
Yeah. Yeah. So true. Yeah.
So,
Thank you, Laura. That's great.
yeah.
Yeah. And I think one of the things you pointed out about when you're talking to other international folks, you have to suspend a lot of assumptions. And because a lot of resources are different, a lot of practice contexts are different. And for me, when I've had those conversations, it helps me boil down to the basic principles of social work and the basic values that guide us. And that really helps me kind of strengthen my own foundation and what it means to be a social worker and what it means to do social work. But then it also really helps me connect the dots that, like, wow, this is powerful that people across the globe are seeing so much value in how social workers do things, that they're all doing it with the same guiding principles and the same guiding values. So even though the context and the resources look very different, we still have this through line of
Yeah.
social work practice, which is really
Humans
cool.
are humans are complicated and need help.
Indeed, indeed.
As
And
a
that we're a little biased in that we think we address their needs a lot better than other, I don't know, better, okay, differently. We'll say
well, and
differently than other professions.
you also when you're talking internationally have to listen for their expectations because
Yes.
they think every American does this and every American is that. And
Oh yeah.
often they have this view of the New York City and Wyoming, and there's nothing in between.
Yeah. Yeah, and that was honestly something I think that was really interesting for that colleague I met with. She actually did live in the States for a bit, so she kind of knew that more, but she knows that a lot of people don't realize that there's a lot of diversity. And
Mhm.
the same way that we learn about other cultures through a movie or through a news headline, they do that with us. So, they just think that things are like the movies here, and we know
Yeah.
that that's not true.
Yep. Yep.
Yeah.
It's interesting.
Some other comments in the chat, talking to a worker in Germany and a worker in Ireland. Interesting to talk to both of them. Yeah, that's really cool. Um, when I was in Italy discussing differences with the tour guide, this came up. They still experience stigmas associated with mental health. They have strong gender roles, can deter people from using resources or disclosing their resources. And then nepotism is alive and well, which impacts care resources. Yeah. We had a professor from Germany. They have licensed social workers in Germany. Okay, but you do have to speak German to work as a social worker there. And then we worked in Belize, and they gave you as a young person a lot of responsibility with limited skills. And then you recently have been working there. There's a little more established, very low resourced. Many communities have one or two social workers to conduct case management for lots of things like mental health, child welfare, and intimate partner violence. They do have a BSW degree that allows for case management work, and they just began an MSW program the last 2 years that's focused in more clinical. That's exciting. Yeah. And Belize is a country that has English as a national language, so it's much more accessible. Immigration rules in Germany are very strict about language. Yeah. Oh, great. I also know that there's funding for us to go internationally to learn from other cultures around child welfare and some other spaces. So you may end up if this has sparked an interest in you, you may be able to explore some ways that you could get some funding to help you travel internationally to do some social work, continuing education or something like that. So um, lots of ways to make it happen. Oh, okay. Well, that was all I had. Thank you, everybody, for your participation and attendance. It's been great to share this with you, and I hope it's not the end of the conversation. I hope we can continue to have interesting trips. And if you go on a trip somewhere or you meet somebody and you learn a lot about international work, then I would love to hear what you learned.
Um, I just put the evaluation in the chat. Sorry, I got distracted by our our conversations, but yeah, this is so interesting. And yeah, I've done work in Belize and a little bit in Colombia, and yeah, I love hearing about how different countries look at social work because there is so many different lenses that we can use, and um, it's really fascinating. Yeah, yeah.
Yeah, no, you've done a lot of work internationally and really done work like on the ground, so you can really speak to that. And there's a lot that we can learn when we see how other countries do things.
Mm-hmm, mm-hmm. Yeah, but excited about Iceland and learning more about the Nordic countries.
Yeah.
Yeah.
I'm in no way affiliated with any travel agency or anything, but I do happen to know that there is a direct flight from Pittsburgh to Reykjavik that
Uh-huh.
happens seasonally.
Uh-huh.
So it tends to follow the typical tourist cycle of like May to November. Unfortunately, when I went, it was right after that ended, so I did have one layover in Boston. But
Mm-hmm.
if you can make it up to Pittsburgh, then the direct flight is pretty easy to go to Iceland.
Mm-hmm. And I also wanted to share that I often have students come to me and ask, how do I get started in international work or how do I get a job in international social work? Um, and I have my own responses, but do you have any thoughts about that one?
Yeah, yeah, I think, starting with language is really helpful.
Mm-hmm.
If you really want to look at those countries that have English as a national language, or at least have space that you could work in English, or if you need to learn a different language, you want to start there. But even the English speaking countries are not always easily accessible for work. So you would really want to find out about the visa
Mm-hmm.
requirements and what it takes to get employed there, because you might have everything else lined up, but then getting a job there is another step. So I think visiting and building relationships is a good place to start. I mean, that's what I did. I just happened to have somebody that wanted to go to coffee. And I'm a believer in relational types of networking. So if you get a chance to study abroad, and you can maybe ask like, hey, could I talk to the local social work program, if you're a student,
Mm-hmm.
or could I talk to a local social worker? Then that could give you kind of a pathway to building relationships.
Yeah, for sure, for sure. Yeah, I know like getting there in the first part can be have its own barriers. I've in random countries I've gone to their universities and just walked into their social work departments and like, hey, can we chat? But obviously I understand that's not accessible for everyone. Um, But even, I often tell folks, like, look on Google, find a location that you might be interested in, see what type of social organizations they have there, and send some emails, right? And maybe do some Zoom calls and make those connections. Um, I think we can use our technology to try to create those networks. And of course, I always emphasize being safe, right? That's really important. You don't want to put yourself in an unsafe situation, but there are a lot of different ways to connect with people all around the world. And yeah, we have a couple students who've done more like international teaching English programs. I've written quite a few letters of recommendation for those. So that's a way to get into another country too. Yeah.
Yeah, that's a great point.
hmm But yeah, thank you. Heather,
Yeah, I think the world is smaller now than it ever has been with our internet and digital connectivity. So we can certainly take advantage of that if we're interested in exploring the world or at least doing some more comparative learning.
yeah, for sure. Okay, well, thanks everyone. We'll make sure you get the CE sent out. And yeah, thank you again, Megan. Have a great day,
Thank you very much.
everyone.
Thanks, everybody.
Yep.